what will happen for many people in states where there is no access to an abortion provider, if they cannot get out of state, many people will be forced into pregnancy. We should acknowledge that that's already happening in states like Texas, which is effectively experiencing a post-Roe world with a 6-week ban and a bounty hunter provision attached to it. People will still continue to seek access to abortion. They may seek access to medication abortion and self-manage care. And we think it's responsible to make sure that people have all the information that they need in order to identify ways to get care. But, in terms of abortion provision from providers like Planned Parenthood, we won't be able to provide those through our health centers. We are not going down without a fight. Our job over the next, few months is to educate people about how we got to this point. And to help them understand that their lawmakers still have opportunities to restore this right, even if in federal legislation or state legislation or their state constitution. And so this will be a fight that goes state by state. If there's someone that is seeking access to abortion and they cannot get it in their state, I direct them to abortionfinder.org. That is for people seeking care. You can donate to local Planned Parenthood health centers, to independent providers through keepourclinics.org. You can support the National Network of Abortion Funds. You can volunteer with many of these organizations to help patient navigation, just to get care to people and get people to care. We've already seen how racism itself is a public health crisis. We saw that laid bare during COVID, and now we're eventually preparing to see another public health crisis that will have incredible disparity connected to it. So we're talking about Black communities, people of color, low-income communities, LGBTQ communities, rural communities, folks who will have to take off work, who are on the front lines, they're already living at the margins, who will have to find childcare because the majority of people seeking access to abortion are already mothers. We're talking about the impacting people who at least afford the gas money, much less pregnancy. We're asking them to carry a significant burden that is just completely unfair and unconscionable. It is indeed a dark time, and it's really important that people understand that elections matter. They have an opportunity to express their viewpoint. The majority of these legislators that are making these horrific bans and restrictions on accessing abortion care are really out of step with their constituents. And so it's now more than ever, it's important to kind of exercise your voice. That is where the hope is. Pro-choice.